Sometimes the most innocent-looking situations can hide a real threat to our pets. Imagine your cat. Seems perfectly healthy, right? But maybe harboring a tiny invader that could be, well, silently damaging its liver. It sounds like something out of a sci-fi movie, almost, but it's a very real concern. Liver flukes. And while we often think of them in, warmer climates, they're actually popping up in more unexpected places too.
That's right. And think of this deep dive as your shortcut, really, to understanding liver fluke infestation in your pets. We've gone through the latest veterinary guidance to bring you the essential information you need to know about it without getting too bogged down in all the technical jargon.
Exactly. Our goal today is to really get to grips with what liver fluke infestation is all about, how it affects our companions, especially cats. It seems what the actual level of risk is, how vets figure out if it's happening, and really crucially, what we can do about it. We've been looking closely at a detailed veterinary guide on this, so let's just dive right in. What exactly is this hidden threat we're talking about?
Okay, let's start with the main player here. Platynosomum concinum. This is the most common type of liver fluke we see in pets here in North America. It's a type of flatworm, and it basically sets up shop in the liver and the bile ducts. It's mostly a problem for cats in those humid, warmer areas, like Florida, Hawaii.
Right.
But what's really interesting and maybe a bit concerning is that there have been these isolated reports even in cooler states. Think Ohio, Illinois. So while it's, much less likely there, it's not completely impossible.
Wow, Ohio and Illinois, that really makes you think, doesn't it? It's not just a tropical thing.
Yeah.
So how do our cats actually pick up these tiny troublemakers?
Well, the way cats get infected with this Platynosomum fluke is by eating an intermediate host, something that's carrying the fluke larvae. Think of it like a necessary stopover for the fluke before it gets to the cat. Typically, cats get it by preying on eating lizards or frogs that are already infected.
Ah, okay. Lizards and frogs.
Yeah, and here's a statistic that might surprise you. In those warmer areas where these hosts are really common, the estimated infection rate in outdoor cats, it can be anywhere from 15% up to a staggering 85%.
85%.
Wow. Yeah. So for listeners in those regions, if your cat goes outside, the chances of encountering this are, surprisingly high. Definitely something to keep in mind.
That is a really wide range. But yeah, even 15% sounds like a pretty significant risk. Are there other kinds of flukes that affect pets? Maybe with different ways of getting infected?
Yes, definitely. While Platynosomum concinum is the big one for cats in North America, there's another one, Metorchus conjunctus, that can also infect their liver and bile ducts. And for dog owners, you've got Heterobilartia americana here in North America. Raccoons actually play a role in spreading that one.
Interesting.
Then there are others like Clonorchus sinensis, Cystosoma japonicum, Metorchus bilis, Opicircus felinius, but these are usually tied to specific places and often involve eating raw or undercooked fish. That's a risk factor you might see in, say, sled dogs, for instance.
Okay, so it sounds like how they get them really depends on the fluke type and where you live. Focusing back on the main one, Platynosomum concinum in cats. Which cats are most likely to get it?
Right. For Platynosomum, it's generally younger cats. Think between about 6 and 24 months old. They seem to be at the highest risk.
Younger ones, why is that?
Well, it's likely because they're just more active exploring and hunting outside, That increases their chances of running into and eating those infected lizards and frogs we were talking about.
That makes sense. Young, curious hunters are probably more likely to, eat something they shouldn't. Now, what about signs? What clues might suggest a cat actually has a liver fluke problem?
This is where it can be a bit sneaky. What's fascinating but also frustrating for owners and vets is that a lot of cats infected with these flukes, they don't show any obvious signs at all.
Really? None?
Yeah, they can be carrying these parasites around and you wouldn't even realize it. However, if the infestation gets severe, then you might start to see more noticeable symptoms.
Okay, like what?
Things like jaundice, that's the yellowing of the skin, gums, whites of the eyes, unexplained weight loss, sometimes quite severe like emaciation, lack of appetite, or even completely refusing to eat, what we call anorexia. Vomiting, sometimes a specific kind of slimy or mucus-filled diarrhea.
Mucodiarrhea, right.
Exactly. You might notice an enlarged abdomen, a general feeling of being unwell or lethargic malaise, we call it, and sometimes even a fever.
Those are some pretty serious signs, especially the jaundice.
Yeah.
So what's actually happening inside the cat when it's infected? Can you, walk us through the journey of this fluke?
Sure. The life cycle of Platynosomum concinum is, it's quite something, and it really depends on that specific tropical or semi-tropical climate, and it needs two different intermediate hosts. So the adult flukes, they live in the cat's bile ducts and the gallbladder.
Okay.
Their eggs get released into the bile, and then they pass out in the cat's feces. These eggs then have to be eaten by the first intermediate host, which is a specific type of land snail.
A snail, right.
Inside the snail, the eggs hatch into tiny larvae called myristidia. These develop through a couple of stages, sporocysts, daughter sporocysts. Then these mature forms emerge from the snail and need to be eaten by the second intermediate host. This is usually an anole lizard, but it could also be other reptiles like skinks, geckos, or even frogs and toads.
Okay, so snail gets eaten by the lizard or frog, which now has the next stage of the fluke.
Yeah.
And then the cat comes along.
Exactly. When a cat hunts and eats one of these infected lizards or frogs, the next larval stage, called cercariae, gets released in the cat's upper gut. From there, these little guys migrate up into the bile ducts, they mature into adults, start laying eggs, and boom, the whole cycle, which takes about 8 weeks, is complete.
Wow.
So the risk factors really boil down to, is the climate right? Are the right snails and lizards frogs around? Does your cat go outside? Is it a good hunter? And does it actually eat what it catches? It's complex, you see. Controlling it isn't just about the cat, it's the whole ecosystem.
It really shows how connected everything is, doesn't it? You mentioned those other flukes too, metorches in cats and heterobilarzae in dogs. Are their life cycles just as complex? What do?
They are complex, yeah, just with different players involved. For metorches in cats, you might first see watery, maybe bloody diarrhea before the flukes even get to the bile ducts. You often see high liver enzymes, sometimes a temporary spike in those white blood cells called eosinophils. Eggs show up in the feces around day 17.
Okay.
Heterobilargia in dogs, and sometimes people too, is a bit different. Eggs pass in feces, hatch in fresh water, infect snails. Then the next stage, the cercaria, comes out of the snail and can actually burrow right through the skin of the dog or person.
Through the skin.
Yeah. The adults end up in veins around the intestines, laying eggs that cause inflammation, and those eggs take about 68 days to appear in the feces. So, yeah, different flukes, different pathways.
It's amazing how intricate these parasites' lives are. So, when a vet suspects liver flukes, how do they actually spot this unseen enemy? Sounds like it could be tough.
It can be, absolutely. Like we said, one big challenge, especially with Platynosomum, is the symptoms are vague. They could point to lots of liver issues, and just finding the eggs in a routine fecal check isn't always reliable.
You said only like 25% detection?
Yeah, for P. cancinum with standard fecal exams, it's only about 25%.
That sounds incredibly frustrating for everyone involved.
Yeah.
Why is it so hard to find them?
Well, it's partly because the flukes might not lay eggs all the time, continuously, and the number of eggs shed can be pretty low, especially if it's an early infection or just not that many flukes. So one standard poop check often just isn't enough.
Okay, so relying on just that isn't great.
Exactly. That's why vets often need to use more sensitive methods when they're specifically looking for fluke eggs. A basic smear might miss them, but techniques like sedimentation, where the heavier eggs sink, or methods using chemicals like formalin ether to concentrate the eggs, they're much better.
Concentration techniques.
Right. They can reportedly find up to 8 times more eggs than a direct smear. Sometimes, though rarely, an ultrasound might show weird structures in the bile ducts that could be the flukes, or maybe examining bile taken right from the gallbladder, or cells from the liver. But really, the gold standard for a definite diagnosis is a liver biopsy, looking directly at the tissue.
Okay, so vets often need to dig a bit deeper than just a routine check.
Yeah.
What about blood work, other lab tests? What can those tell us? Once they have samples, what are they looking for?
Yeah, good question. Looking at the lab results, the clinicopathologic features, especially for Platynosomum in cats, can give some important clues that the liver's stressed, even if it's not specific only to flukes. On a complete blood count, or CBC, it can vary, but sometimes you see that increase in eosinophils, those white blood cells we mentioned.
Eosinophils, right.
Yeah, that eosinophilia might pop up around 3 weeks after infection and stick around for months. But importantly, not all infected cats show it. On the blood chemistry panel, you'll often see high liver enzymes, ALT and AST are common ones. Another enzyme, ALP, might be normal or just a bit high early on. Bilirubin levels are often up, and in really severe cases, they can be sky high, causing that jaundice.
Okay.
A urine test might also show bilirubin, and blood tests might show increased bile acids. But, and this is really crucial, a single negative fecal test doesn't rule it out. You might need repeat tests using those better concentration methods, especially with mild infections where egg shedding is low.
So blood work gives hints the liver's unhappy, but isn't the final answer on its own. What about imaging, like the ultrasound you mentioned?
Right. Regular x-rays might not show much, maybe just a slightly enlarged liver, but ultrasound, abdominal ultrasound, can be way more informative. It helps the vet see if there's a physical blockage in the bile ducts, which can happen with severe fluke infections versus just general liver inflammation. If there is a blockage, you might see a really full gallbladder, a larger than normal common bile duct, dilated ducts inside the liver.
Okay, signs of a backup.
Exactly. You might also see sludge or sediment in the gallbladder. And sometimes, if you're looking closely, you might even see the flukes themselves, little dark oval shapes, maybe with a bright spot inside. The gallbladder wall might look a bit thick, suggesting inflammation. And the liver tissue itself might look different, maybe brighter around the vessels, which points towards that inflammation, cholangiohepatitis.
So ultrasound gives a much better look inside. You also mentioned biopsies being more definitive. When do they go that route?
Well, finding eggs in the feces, especially with concentration methods, or maybe finding them in bile collected directly from the gallbladder, that procedure called cholecystocentesis.
Right, aspirating the bile.
Yeah, those can be very helpful, but a liver biopsy really is the most definitive way to diagnose it. It lets us look right at the liver tissue under a microscope and see the actual evidence of infection. When we look at the liver itself, say during surgery or biopsy, it might look enlarged, maybe a bit greenish or yellowish. The bile ducts might look obviously widened. Sometimes you can even see the flukes in the ducts or gallbladder.
Wow.
Then, under the microscope, we see changes over time. Early on, like 4 or 6 weeks in, you see enlarged ducts, lots of inflammatory cells around them, especially those eosinophils. Mid-stage, maybe 4 months, there's often a big overgrowth hyperplasia of the cells lining the ducts, plus ongoing inflammation. And later stage, say 6 months or more, you can get a lot of scar tissue, fibrous tissue forming around the bile ducts. That can actually narrow them, potentially blocking them.
Gosh, so these tiny things can cause quite a bit of structural damage over time.
Yeah.
Okay, so once you finally have a diagnosis, what's the treatment plan? What can be done to help these cats get better?
Well, treatment can often be done on an outpatient basis, especially if the cat's not too sick. But if a cat is severely ill, then definitely hospitalization and intensive supportive care are needed.
Supportive care meaning?
Meaning things like intravenous fluids, IV fluids to fix dehydration and electrolyte problems, often need to add potassium. Nutritional support is really vital too, because these cats often won't eat. We need to prevent fatty liver disease, hepatic lipidosis. So that might mean tempting them with high protein, high calorie food, or maybe using feeding tubes to make sure they get enough nutrition. Rarely, 5e feeding parenteral nutrition might be needed. Or if the liver disease is affecting the brain, maybe temporarily restricting protein. And B vitamin supplements are important, especially if they're not eating and getting fluids.
Okay, so job one is stabilizing the cat and getting that support in place. What about medications to actually, kill the flukes?
Right. The main drug, the treatment of choice for Platynosomum in cats, is praziquantel. Usually it's given as injections under the skin once a day for 3 to 5 days at a specific dose. One thing for owners to know is that even after successful treatment, the cat might keep shedding fluke eggs in its poop for up to 2 months.
2 months. Okay, good to know.
And praziquantel also works for that dog fluke, heterobilharzia, though the dose and how it's given might differ. Now, if the cat has significant inflammation seen on biopsy or based on severe signs, vets often add a corticosteroid, like prednisolone, to calm that down, usually start higher, then taper the dose.
Okay.
Another helpful drug can be ursodeoxycholic acid. It helps bile flow better. It's a pill, usually given with food. But you have to be careful if there's already a known blockage in the main bile duct outside the liver. We also often use broad-spectrum antibiotics. This is to prevent or treat secondary bacterial infections that can pop up in the bile ducts because of the flukes being there and then dying off after treatment.
Makes sense.
And antioxidant therapy can help too. Things like vitamin E and same S-adenosylmethionine, they support liver health, help with the inflammation damage, usually continue those until the liver enzymes look better. And finally, anti-vomiting meds, antemetics like metoclopramide, ondansetron, or meropitant might be needed to make the cat more comfortable and stop fluid loss. Oh, and it's worth mentioning, pregnancy is often a reason to be cautious with some of these drugs.
That sounds like a really comprehensive, multi-pronged attack on the problem. So after treatment, what's the follow-up? What do you watch for?
Yeah, careful monitoring afterwards is really key. You want to see those clinical signs improving, right? Is the appetite back? Are they gaining weight? We'll also track the liver enzymes and bilirubin with blood tests and do repeat fecal checks using those concentration methods to see if the eggs are gone. It's also important, though not super common, to watch for any signs that the bile ducts might have gotten blocked after giving the praziquantel as the dead flukes pass through.
Right. And thinking longer term, prevention. What can owners do to stop their cats getting liver flukes in the first place?
Absolutely. In those areas where Platynosomum is common, the number one best way to prevent it is to limit or ideally completely stop your cat's access to the outdoors. If they can't hunt and eat those infected lizards and frogs, you basically cut off the infection route.
So keeping them inside is the safest bet in those regions.
Pretty much. Now, for cats that do go outdoors in those high-risk tropical climates, some vets might suggest giving praziquantel preventatively, maybe every 3 months or so.
Okay, that's an option too. What about worst case scenarios? What complications can happen if it's not treated or if it's a really bad case?
Unfortunately, yeah, if it's untreated or very severe, liver fluke infestation can lead to some really serious problems, even life-threatening ones. You can get severe liver damage, potentially leading to liver failure, which can be fatal. Bile duct blockage is another major risk. We can also see inflammation of the pancreatitis. And with chronic long-term infections, sometimes the pancreas stops making enough digestive enzymes. That's pancreatic exocrine insufficiency. And just general inflammation and infection of the bile ducts and liver tissue, that cholangitis or cholangiohepatitis, is also a risk.
Those sound like really serious possibilities. So
Right.
what's the bottom line? What's the overall outlook, the prognosis for a cat diagnosed and treated?
Well, the good news is that for most cases, if you catch it reasonably early and get the right treatment started, we generally expect a full and uncomplicated recovery.
It's definitely good to hear.
Yeah, timely diagnosis and appropriate treatment are really key to getting that positive outcome.
Okay, that's reassuring. So to just quickly wrap up our deep dive here, liver fluke infestation, especially that Platynosomum fluke in cats, is well, a significant health issue in certain mainly warmer regions. It can often be hidden, no obvious symptoms, so specific diagnostic tests are often needed. And thankfully, effective treatment is available. It really highlights the importance of awareness, especially for those of you listening who have cats in or maybe travel to those endemic areas, and particularly if you have young cats that love exploring outdoors.
Exactly. And, it kind of makes you think, given this really complex life cycle, right, involving snails, then lizards or frogs, then the cat, what other infections out there, maybe things that seem simple on the surface, could actually have these surprisingly intricate ecological webs behind them? And maybe consider how broader environmental changes, climate shifts, changes in wildlife populations, how might those things impact where and how often these kinds of parasitic diseases show up. It really underlines how connected everything is, the health of our pets, wildlife, and the environment we all share. Something to ponder.